Thank you very much for staying tuned to Development Focus with Jide Ojo on ITV this June 9th, 2021. It's always a midweek edition of This Morning on ITV. We are going to be discussing health, the Fourth Republic, and I have a seasoned journalist, a correspondent, health correspondent of note, joining us on this segment. Her name is Ajia Akimat Ali. You're welcome on the show.
Thank you.
It's a pleasure to have you. Tell us a bit about yourself for the benefit of viewers who may never have met you.
Okay, my name is Hakimat Aliu. A journalist, like you said, the health correspondent. I think I've been practicing journalism for, let's say, 11, 12 years now. Yeah. Part of which 8 years has gone to covering health within the Federal Capital Territory.
So you are more or less Mama Health. So,
you can say that thing.
So let's look at this Fourth Republic. We are celebrating 22 years of our return to democracy. On June 12th, you know, we used to have it on May 29th, but graciously, Mr. President, from last year, changed it to June 12th. So June 12th will be Saturday, but already it's 22 years of return. So let's look at how have we fared health-wise in Nigeria? What's your panoramic view of our performance health-wise?
That's a very broad one.
Yeah, it is. But we'll move from general to particular.
Yes. Okay, when you talk about health, you're not just looking at timely access to maybe medical attention. It's a very broad thing. You're looking at surveillance. We have what we call medical surveillance. That you track, monitor outbreaks of diseases. And you know, Nigeria, we've had our own fair share of outbreaks, diseases. We can list them from polio, Lassa fever, Ebola, tobacco. We have a whole lot of them that we've
and
we've
the
had
mother of them all.
COVID-19, and we're still in it. Hopefully, it's just that we didn't have it as bad as in other countries. So I think Nigeria as a country has been trying. We cannot do it all. The government has its part. It's been trying to do the needful. And when it comes to healthcare, you remember in Nigeria, the type of healthcare we practice, we have primary, secondary, and tertiary. The federal government is only burdened, has limited role to play when it comes to just the federal medical centers. We have the university teaching hospitals and all that, while the state government has to deal with general hospitals. Then the primary healthcare, that's the clinics, dispensary, that's the role to play for the local governments. They are all divided. But I think the drawing board, there's something missing. There's something missing, and if we have to get it right, we need to maybe go back to the drawing board. If each of these tiers of government, like, you know, this is in charge of this is in charge, if they go back and take their roles properly, the way it should be done, I don't think we'll have any problems.
You mentioned, before we come to the missing link,
yes,
we have recorded some successes, isn't it? We managed to exit polio. Finally,
yes.
Nigeria Nigeria happens to be one of the paying countries. Yeah. You know, there was a workshop I attended.
Afghanistan,
God bless you.
Nigeria.
Pakistan, Afghanistan, India and Nigeria.
Yeah.
We were the last four, and Nigeria is the last of the last. We actually was the end in the pain. So honestly, eventually we were able to exit polio after many decades that we have been kicking out polio.
Polio fights. Polio,
unfortunately, we've not been able to kick out malaria.
Yeah. Okay. Polio, like you said, we kicked out polio was successfully, finally, though we had issues of, you know, Nigeria, we had boycott. It wasn't just about the government, the policy this time around. It was about vaccine. Just take these vaccines to kick out polio. The primary health care, because I worked with them, I covered this, we go out for immunization exercises and all that. It was greeted with boycotts. We all know that. They say, these vaccines they are coming to give you, it will make you this, it will make, in fact, they'll say it's the cause of the problem. Information is key. So they had to deal with enlightenment, letting those people know, oh, this is for your own good. Aside that, then we keyed in and people took the vaccine and it left. Malaria is the same thing. We have is information, I think, passing the information right. How do we kick out malaria? Mosquitoes, as the vector causing malaria. Keep your environments clean. Use maybe insecticides, sleep under treated mosquito nets and all that. The policies are there, but I don't know, is it the implementation or the people? That's where the problem is for malaria, if you ask me.
I'm asking you actually.
If you ask me, the problem.
What is the missing link? Why have we not succeeded in curbing? I mean, you see the number of deaths
from malaria.
Okay. We are told that malaria has killed more people than accidents have killed. Malaria has killed more people than HIV/AIDS have killed. Malaria have killed more people than COVID-19 have killed. Every year, what
Recently,
is the problem?
we just marked the World Malaria Day worldwide.
Yeah.
If you look at the high burden where these cases are reported, mostly people in the rural communities had to reach areas. Like we said, this role lies with the primary health care, taking the information to the people. And what do you need to to treat malaria? Simple anti-malaria drugs. You see, what they call it, secondary, having to play roles. People go to, if we get it right, like I said the first time, if we're getting it right, you don't have to see people with malaria cases going to secondary facilities, general hospitals.
It can be taken care of
at the primary level,
primary centers.
And where we have this problem, it's the rural area, where we should have these clinics and dispensaries. But we know what the problem is. Infrastructure, poor infrastructure. In places like when governments, administrations have been trying, they come in with this commitment of improving the healthcare system, starting from the primary level. They've tried their best. You see, building constructions of primary healthcare centers. But what about the equipment? What about personnel? So they need to do more. Get this. If you are building a facility, this is a primary care center. It should not just be a building. You have to equip it with facilities, the drugs, the personnel. But when you go, you don't find these things there.
Okay. Now, Akimat, you've been covering health sector for close to 10 years.
8.
8 to 10 years.
Yeah.
So now, look at it this way. COVID-19, what's your assessment? I saw you in that PPE when you went to the isolation center last year.
COVID-19.
How did you think Nigeria has handled? You covered Ebola?
Yes.
So if you compare Ebola and COVID-19 in terms of government response, how will you appraise that?
Government response. The government, like I said, is trying its best. Okay, Ebola came before COVID-19. Even in between Ebola and COVID-19, we had Lassa fever.
We are still having Lassa fever more than 15 years.
The outbreak, we were still battling with Lassa fever, I think, late 2019, crossing over to 2020. It was just that COVID came with all seriousness and it was new. Not just to us, but the world at large. It was a new thing. So, but when you look at it, like for Ebola, the government actually put in infrastructures to handle these cases in Ebola. If you go in states, Lagos, like when COVID came, Lagos had their own facility to help them. It served them for handling COVID-19. But when you look at other states, I think some states had to start from the scratch to get these facilities, infectious disease hospitals. Some states had to start from the scratch to manage it. COVID-19, we were lucky as a country, at least. We were not close to being the worst hit. In other countries, you know the cases.
Brazil, America.
You can name it. India of late.
Yeah.
You see dead bodies in the country. But Nigeria, we didn't have it that bad.
How did we manage that? What's the success story?
The success stories, I think everybody rose up to the occasion. The health workers were on ground willing because it was a challenge to everyone. The like we know, they said COVID-19 is like a blessing, some people would say. It exposed some of the lapses we had in the health system, and they needed to address it urgently to attend to this disease. So that was like the advantage.
But you know something that surprised me with COVID-19, the human spiritedness of Nigeria. We became our brother's keeper.
Honestly.
People were sharing out food items, institutions, palliatives. Even private sector, Kakovit, was able to mobilize over 30 billion. Is it all because we were all infected or affected? Somewhat because nobody could go abroad and nobody could go
treatment.
So everybody was like, let's take care of ourselves, otherwise we'll perish together. Was that because I've never seen that kind of response, not even with Ebola. Did we have that kind of human spiritedness that religious institutions, private families were just all out, helping out with palliatives, with even donation of PPEs and medical supplies and laboratory equipment? What struck you in that kind of perception of how the private individuals and corporate organizations responded to COVID-19?
I think it was impressive coming at the way everybody stood up. Like I said, we rose up to the challenge occasion. Like everybody had to contribute. You brought up something. You said something about, okay, is it because you couldn't travel out? Yes, we are all here together. We have to deal with it. So everybody rose up, and that's the spirit. That's what we should see. When we have a challenge, like when you talk about medical tourism, people going abroad to get medical attention, who are the people attending to them there? They are the same people who left those countries. Where you have the issue of brain drains, you see doctors, they say, okay, maybe because they were not well paid and all that, they are not well paid, they are not satisfied with what they are being given here. That's why you see them exiting for greener pastures. So if that attention, the way we all rose up and worked, then the government on its part too. Recently, you heard they are going to be paid 350% hazard allowance. That energy, if we all channel it, I think we won't have the issue of medical tourism. People will all deal with it here. It's still the same doctors.
Yeah, it's the same doctors, but pardon my ignorance. Why is there still restiveness, so much restiveness in the health sector of Nigeria? Every now and again, in the health sector of Nigeria, every now and again you hear doctors have gone on strike. If it's not doctors, it's nurses. If it's not nurses, it's other medical personnel that are, even in the handling, during this COVID-19, they still went on strike. How do you think, and why do you think we continue to have this restiveness in the health sector?
The health sector generally, it's, let's say, challenged with three things that we all know. That's the root cause of almost everything. The funding, inadequate funding. Then we have the infrastructure. Okay, most times when they go on these actions, strike actions, yes, industrial actions, it's either they don't have what to work with or the funding. Because people, most times when I cover this, okay, they've gone on strike, you're like, what's the demand? Like, if they don't meet up our demand, we're not. It even during the COVID-19 time, at the time it was like emotional. People like, at this time when we are dealing with a pandemic, doctors had the guts to say we are embarking on a strike. It was shocking for a lot of people, but the doctors felt like, no, don't look at it that way. We are also human. We come out to do this.
And we also have families, and we've lost loved ones. Like
and we're at risk of these infections just like everyone. So we need to be protected. But I think all that was solved at the time. You didn't hear any strike again. It was about PPEs. They were complaining about the protective gears. You can't expect me to go and attend to this without being well equipped. So the fought for all that. It's just the funding, but government cannot. Government has to deal with education and other competing.
Yes, I know that, but
budgetary allocations.
You are a journalist, and there have been reportage of in the recent past, cholera still killing people in Plateau, in Bauchi.
Recently.
And I wonder, Can't we get a vaccine for cholera? From the days of my great-grandparents, we've been having cholera. Why is it that we have not been able to solve the problem of cholera, just like that of Lassa fever, which was discovered in Lassa in Borno State over 50 years ago? What is the issue?
Research. Funding for this research to carry. I think people are willing. The health professionals are willing. The government too. The policies are there. It's just implementation. Implementing these policies. Look, like vaccine is not something you just wake up. COVID it's like an exceptional case. Everything happened so fast. So that same energy, if it could be channeled to others, like you said, cholera still killing people at this stage. And maybe because it's for us, if it was a global thing, I'm sure the global community will have all risen up, collaborate. So this is our thing, and we need to just stand up and find a way out.
Now, even though I know, I'm aware you are not a medical practitioner, yes, but I just wonder, and I'm wondering aloud, if you have thoughts on how do you think we can deal with, non-communicable diseases? Non-communicable diseases that
are still public health issues.
Still public health burden. Why is that so? We still have issue of infant and maternal mortality. We still have issues with even other non-communicable diseases that you think we should have been able to overcome at this level of our national life. Why is it still a big of a channel? We know of the communicable diseases like cholera and all of that, so you can get infected and all of that. But when you talk of onchocerciasis, you talk of epilepsy. Epilepsy is communicable, but there are other diseases let's even zero in on this infant and maternal mortality. You are a mother yourself. What do you think we need to do differently about the issue of infant and maternal mortality in Nigeria?
Okay, infant and maternal mortality has been quite a challenge for Nigeria and other countries of the world. I think Nigeria contributes like 20% to the global statistics. India 14, that's India and Nigeria alone contributes for 34% of the statistics, having deaths from maybe while the pregnancy to term, or at birth, while birthing a child, or immediately after birthing a child. It's just the inadequacy in access to health care. And these problems, at the basis, primary, these are things that should be handled at the primary level of healthcare. But the good news, I think recently we launched a national reproductive health policy. It was documented, the basic things that needs to be done to avoid, and if you look at statistics, there's been a reduction. Though we still have...
not significant.
To an extent, in 2017, we're having like 1,200 per 100,000. But now you have 900, and I think
anyway, I don't want to go into. There's a reduction.
There's a reduction, and hopefully with the national reproductive health, they are training these workers at the primary level. Where do we have this challenge? In the rural hard to reach, they call them hard to reach terrains. You have mothers in maybe access to a near clinic to have their child is a problem. Maybe while having the child at home. Certainly you have all those deaths occurring. So you need to be attended to by a professional. So the primary health workers, I think they are rising up to the occasion. They've been doing trainings and all that, trying to find out these hard to reach locations to set up their own clinics there and assist the mothers. Hopefully it will reduce. We'll stop having cases of maternal.
Let's talk briefly about female genital mutilation. What's your position? And how do you think government can handle it better?
Female genital mutilation. Okay, I think there's an international day for almost all health issues in the world.
And it's an SDG issue.
Yes.
Yeah.
So I think there's been, for me, obviously we know it's something that the world is preaching against. but you still find them happening in rural communities. But to an extent, I think there's been a reduction in these practices. In those days, we used to have it a lot, everybody. It's compulsory circumcision for the female child. In local communities, I think you even see them, you see mothers, you've seen images, videos, and it's done locally. You see the
traditional,
attendant, which is instrument. You see mothers with their children all around and all that. But it's just about enlightenment. These people need to get the information. If you have the information, you're good.
Okay, as we wind down, because I know there is a lot to discuss, but as we wind down, let me pick your brain about the role of education in solving most of these our health challenges. It's not about throwing money at issues.
100%.
I think we are still largely afflicted by superstitious beliefs and
misconceptions.
Misconceptions.
Honestly.
So, who do you think should be saddled with this responsibility of
education,
health education, so to speak?
Okay.
Issue of hygiene. You know, we are talking, or even water, sanitation, and hygiene. It has been said that for many of the communicable diseases, if we only embrace wash, we can reduce it by half. So, what's your take on this? Water, sanitation, hygiene, education. How do we roll out and get it more effective?
Okay, you know, the media too has a role to play in enlightening.
That's why I brought you here, because you belong to that constituency.
Enlightening the public, like, information is key. It's power. Once you have the right information, you're good to go. And under the Ministry of Health, they have this health promotion department. Is their role to do or carry out some of these enlightenment campaigns to inform like you said, just simple
water
practices. Wash your hand with soap and water. It does it. It saves us like 90% of a lot of diseases, germs and all that. Simple practices, learning about them and doing it the right way will be done with it. So even National Health Act recently, the 2020, it was launched, the health promotion, and they've been carrying out campaigns, but you know, somehow it's just never enough. So we have to keep intensifying these campaigns.
So as a journalist, your last comment, as a journalist, what is your high point in covering health sector? What is that memorable thing you have about the coverage of Nigeria's
I'm sure you know the answer.
I don't know the answer.
COVID-19, of course.
Okay, that was your high point.
That was my high point, honestly, when it broke out. Like, it's my beat. I cannot run away from it. People had to know about this disease going on. You know, I went as far as going into isolation centers firsthand. Yes, putting on the PPEs, going into isolation center to give those people firsthand information. That was my high point. Like, I've never had it that, because I'm, like, you know, human and flesh. I had my own fears too. Yeah. I was worried about myself, the people. What am I doing? Going into isolation center, coming out, and what happens? It was for me.
Okay, it's a pleasure to know that Akimat Aliyu has come out of COVID-19 coverage successfully, looking radiant, and we thank Allah for the opportunity to be alive to tell your stories, and we wish you the best of luck as you go on in this onerous task of bringing information to people about Nigeria's health sector and what people need to know. I do hope that when next we call you to feature on this program, maybe specifically on a particular segment of the health sector, you will oblige us. Thank you very, very much.